pandemic, at least the lockdown phase, was almost beneficial. They already had anxiety, but it didn't exacerbate it, actually reduced it.
Those with anxiety who would experience anxiety, their stressors oftentimes have gone away. Now, as we move out of the pandemic, it'll be interesting to see how that changes.
I think on whole, these average levels of resilience kind of suggest maybe more than we would have expected before the pandemic. I think there have been some groups that have really struggled.
One of the lessons I've learned is really looking for those vulnerable people that aren't necessarily like the majority.
During a pandemic, the inequalities in our society are exposed and exacerbated, highlighting why it's so important to tackle these inequalities as much as we possibly can.
Those who have suffered from the social and economic consequences of the COVID-19 pandemic are much more affected by mental health problems than the general population.
People more vulnerable with low access to mental health services.
We saw a deterioration in mental health amongst those in the emerging adult age groups, and particularly young women.
Children and adolescents who, because of their immaturity and developing age, may feel more anxious and depressed.
Over that first year, parents reported clear increases in their children's mental health symptoms, and interestingly, their parents also reported high levels of stress.
Individuals pregnant during this time have had significantly elevated levels of stress, anxiety, and depression. We can expect that there will be a higher need for support.
The dual kind of exposure that healthcare workers were really at risk themselves.
Those who are already disadvantaged are further disadvantaged. The concept of levelling up has got a lot further to go.
This pandemic has really shown us the value, firstly, of having longitudinal cohorts already set up in the population so that infrastructure is already there.
I hope that we will come out of this crisis with the idea that it's important to monitor population mental health in general.
Having the resources that mean that we can have these studies ready to go is really important for any future pandemics.
We can mobilise really fast when we want to, and part of that is about our network.
We've been able to start connections both in the UK and more internationally. So I think having those connections built, then we will be more prepared for the large-scale crises or pandemics.
It's really enabled us to create collaborations around the world and work together much more effectively.
It will certainly not be a time for complacency or for sitting back thinking that's our job done. Somewhere around there, there's another epidemic of one type or another, and we should plan for it.